Welcome to the Neural Implant Podcast, where we talk with the people behind the current events and breakthroughs in brain implants in an understandable way, helping bring together various fields involved in neuroprosthetics. Here is your host, Laden Yurachek.
Hello, everyone. Welcome to the Neural Implant Podcast. Today's guest is Dr. Justin Sanchez. And as we were talking about before the episode, this kind of fills out a tradition of a kind of a debriefing for DARPA directors. Once they've moved on, then I talk to them and see what it was like a little bit. So I start out with Dr. Jack Judy, which is out now my advisor, graduate student advisor, and then to Doug Weber, and now Dr. Sanchez. Dr. Sanchez, pleasure to have you on the show. We met briefly before many years ago, but you finished off your time at DARPA and now are working at Battelle. So yeah, I'm really excited to hear about this and pleasure to have you on the show. So thank you for coming.
Yeah, it's really great to be here. Thanks so much for the invitation, and I'm really looking forward to diving into all of this with you today. So much ground to cover.
Exactly. So I'm always a little bit surprised when I realize how small the world is, because you have quite deep roots here in Gainesville, Florida, which is where I'm at right now. You were here for God knows how many decades, but do you want to maybe start at the beginning and talk a little bit about your work here in Gainesville?
Yeah. So first, Gainesville is a wonderful place, and I miss it dearly, and I wish I could go back very soon. But you're right. My roots in neurotech really come from Gainesville, and I did the majority of my degrees at the University of Florida. And there's a really interesting story there. During my early days of working in neurotech, there really wasn't a neurotech field. And you would be hard pressed to find even undergraduate or even graduate program that was focused on neurotech. And yeah, I was very fortunate to be in a program there that had the flexibility to create a program and to actually find people that had the relevant expertise that would be needed to pioneer work in that field. I reached out to a leading expert in computational neuroscience and adaptive signal processing and learned that field and became an expert in that field. I reached out to clinical partners there, so neurosurgeons and neurologists, and learn their trade and their craft and how they treat patients and what the priorities were there. I reached out to the pure neuroscience community at the university, and was able to sync up with some of those researchers and learn about the fundamentals of neuroscience. And it's through that openness and the willingness to bring all of those fields together that to me really was instrumental in being able to do the work that I not only did as a professor, but at DARPA and then beyond into my current role over at Battelle. So again, that's why I very feel connected to the University of Florida, because even though in those formative years, there's a willingness and openness to bring together a whole new area of study.
Yeah, that's fascinating stuff. And I'm sorry to date you a little bit, but you were a professor there at UF from 2004 to 2010. So in my mind, that's the beginning days of a neurotech. Do you want to talk a little bit about what you were doing there and what your research was at UF? Because you did your bachelor's, master's, PhD, all in one place, which isn't very common.
Yeah, it's very uncommon. And quite honestly, I think I took a lot of flack for staying in one place for that long of time, but I had a motivation for doing that. Again, it was the early days of neurotech. Again, go back to the literature during that time, right? The early 2000s. People were just starting to do large-scale neural recordings in awake behaving animals. It was the earliest days of just proving out how to do brain control of something. And yes, there was work that had happened before that, but it was really getting critical mass during that time. And as I was trying to help form this field and work with the investigators at the University of Florida, I felt that we had momentum. Again, it was everything from my graduate studies all the way through to when I was a professor. There was momentum building in terms of proving out the fundamentals of neurotechnology that were needed for brain-machine interfaces. And it didn't make any sense to me to try to pick up and go someplace else just for the sake of moving, right? Because you always hear in academia, oh, you got to do, one part of your study here, and then you go to this other place and work in this other lab. And then after that, you go to this. Yes, diversity is great. Yes, diversity opens your horizons and things like that. When I was at UF, I had a lot of diversity internal. I just described to you, again, adaptive signal processing, neurology, neurosurgery, neuroscience. The expertise was all in-house. And again, it's when you're trying to establish a field, I felt that consistency and focus was more important than just picking up and going somewhere else. And again, that was a hard decision back there because, again, in terms of a career, people were telling me, oh, you'll never be able to establish your academic career unless you go and move to another place. I'm like, guys, this doesn't make any sense to me. What's most important is to do great work in the field and establish a foundation of the field. So that's the choice, that I made back then. And again, in hindsight, I think it was the right one, even though it was a hard choice.
Yeah, I have heard about it. It's seen as incestuous, but it's a little bit, I guess it is a risk, but at the same time, the risk really comes from when you're trying to find your career, like your first job after you finish your PhD. And the fact that UF then hired you as a professor, like that just negates everything there. And they must have seen, oh, that wasn't incestuous. He really was taking ideas from everywhere. So yeah, let's talk about the professorship. What were you doing there?
Yeah, one of the ways that happened was that there was a desire to do in a synergistic kind of research program, which we're doing animal neurosurgery to do large-scale neural recordings in animals and do that in parallel with clinical studies in humans, also large-scale kind of neural recordings in establishing understandings of cognitive function in the brain. Again, motor all the way to memory and other kind of areas, and then apply that in a brain-machine interface framework. If that desire to do those kinds of things wasn't there, again, it would be very hard to make that move. What I established at UF was a lab to do that. I learned how to do neurosurgery, and we were doing awake behaving kind of recordings in both of those domains. And so what was happening, if you go back to publications during that time, what we were doing. So we were doing direct brain control, so motor control using advanced algorithms. We pioneered stuff like reinforcement learning algorithms and closed loop control of using those kinds of algorithms that could co-adapt with the user over time. We recognized very early from some of those DARPA programs that we worked on during that time. So again, we worked on that first brain-machine interface program that was at DARPA while I was at UF. And we said, look, you train an algorithm on day one, it doesn't really work too well on day two. You had to do all this kind of retraining. And we were already projecting out during that time, if humans were ever going to be using neurotech in like daily life kind of activities, they're going to have to adapt with the user. So we figured out a lot of the algorithms that were needed for those kinds of applications. The other thing that we were really focusing on during that time, and again, this is in hindsight, it feels crazy. Back then, we were developing fully implantable wireless neural interfaces. And that was some work also did with John Harris in ECE. He's now the chair of ECE. And it was, fully integrated chips that could record and transmit out full bandwidth data. And I was just having a conversation with somebody like 2 weeks ago, and they were talking about like fully implantable systems and what the design constraints were and what's been used. And I was like, we figured that out a number of years ago, and it's still in the development phase through others that are trying to make those kinds of systems. So it's interesting to see those two pieces of work still being relevant today and people still trying to solve those issues.
Maybe it might be frustrating. Resolve it. No, you don't have to reinvent the wheel. It's already been done.
Yeah. This brings up an important point. And neurotech is still a really hot field right now. There's always, you just talk about podcasts, there's general media stories. There's a lot of hype around neurotech. If there's one message, at least for the people listening in, is do your homework on what research has already been done in this area. What's truly new versus what has already been figured out? And then what are the challenges of the future, and how do those challenges how can they be leveraged given kind of what has been already figured out in the past? I think having a deep understanding of all of those things is just incredibly important so that this field doesn't become like a hype curve. It becomes a solid, sustainable, and ever-growing field of neurotech moving forward. Just so important. Again, for anybody at any stage of working in neurotech, whether you're an early student figuring out your path or somebody trying to do like a VC, supported startup in this field, you got to know what is real and what is not.
Yeah, I had a roommate and he used to joke that a year in the lab could save you a half-hour conversation. So talking to the right people can really accelerate you. And so that's the point behind the podcast as well, because sometimes papers can be hard to absorb and blah, blah, blah. But yeah, reading the papers and seeing what's already been done, the groundwork that's been laid before, I think is very important. So on the show, and when we're talking about the other DARPA directors, we talked about the moment you got tapped on the shoulder. Is that when you were tapped on the shoulder to go serve? Because I think you served, you did DARPA 2014 to 2018, and then there's still like a 4-year gap there, right?
Yeah. So I started my academic career at the University of Florida, and I was working on a number of DARPA projects at that time. And I did get a call from somebody at DARPA. Again, I knew the agency very well. I felt that place was always, it felt very natural for me. Like the style of research that I always like to do, I think it was the same kind of style that DARPA uses in terms of their innovation. And a lot of people will tell you this that have ever been at DARPA. You just get a phone call out of the blue. And that phone call is, hey, we need you to come to Washington, D.C. and be a part of DARPA. And there's only one answer when you get that phone call. It's yes, the country is asking you to serve, and then serve in a place like DARPA, you go. So I didn't really even have to think about it at all. It was, yes, I'm ready to serve. This is an extremely important field of research. And this is my opportunity to serve the country in a way that will make a big difference. Now, in terms of the timing, I had spent a number of years at the University of Florida, but I had also, around that time, I had just moved to University of Miami. So I spent some years down there too. And a little bit about that, I was always driven to try to get neurotech to humans. It was always about doing the fundamental research that we had to do, but always pushing it to try to get to humans. Down in Miami, they had the Miami Project to Cure Paralysis. And I wanted to be in an institute that had direct connections to patients, that was really focused on spinal cord injury and looking for new solutions. So I spent about 3 years down there, again, built an animal lab, so non-human primate lab, but also in parallel did work with humans living with spinal cord injury. And again, that was a critical experience to feed into the work that I got called to do over at DARPA.
So it was literally just a phone call. Hey, come to DC. Yeah. We want to talk.
Yeah. And think of this. Okay. So this is the other kind of thing I share. I was living down in Miami at the time. Again, I had, my family was there. My extended family was down in Miami, had a beautiful house on the water. Again, you're doing research in a place that's like a resort, right? Again, people like try to retire to Miami. A lot of people probably would have said, I'm already in Miami. I've got this great thing going, millions of dollars in funding in a resort area like that. A lot of people work their whole lives just to get to that. But again, I got that call from DARPA, and it was, I have to serve the country. I have to give back. This is an opportunity to go. And I packed up the family, and it's like 30 days or so between getting the phone call, getting approved to join the agency, and actually just starting. Now, here's the other thing that was happening right at that time. President Obama was launching the BRAIN Initiative. So that was the other part of the phone call. It's, we're launching this BRAIN Initiative. We need you to come to DC to help to lead it. And it was just incredibly exciting times. Just think about this. The President of the United States is saying, we are going to be an international leader in neurotechnology. That doesn't come around very often when those conditions come together. I was also thrilled to go and be a part of that. I mean, it was so exciting to say, okay, we're going to start this effort. Let's figure out what the directions are. Let's push in those directions. We had the support from the highest office in our country. We had resources to do it. And there was a drive and excitement to be the world leader in those kinds of things. So it was just awesome. It's like, yeah, let's go do it. It was like no problem to pack up the family in 30 days and disrupt all of our lives to go and do that.
Yeah, sounds like a no-brainer. I know Doug Weber, actually, he kept 2 offices, or he would commute. And he had a much smaller commute, but for Miami, that commute would not be feasible. Yeah. So
just a quick note about that. Again, a lot of people don't know about this, and I think it's important to share with your audience. I went to DARPA on something that's called an IPA, I think an Interagency Personnel Act. So people don't know this, but our country has mechanisms to help to get people from whatever job that they're in to serve the government. You can help the government. But when you're in one of these IPA positions, they hold your job from wherever you come from. Again, it makes it easier to move. I still had my university job for a couple of years while I was serving at DARPA. And if my time at DARPA, again, everybody's term limited at DARPA, when that term ended, I could have gone back to Miami. What happened to me, though, was that I was originally hired in as a program manager at DARPA, and I did that for a number of years. But then I had gotten tapped to be the office director of the Biological Technologies Office. And that has to be a full government official. So actually, I resigned my position from the University of Miami and became a full government official during that time.
Oh, okay. So that doesn't sound as disrupting, I guess. That does sound like a little bit easier transition and potentially 2 paychecks. That sounds nice.
Yeah, you only get 1 paycheck.
Okay.
The government has gotten smart about these kinds of things. That if they need people from very specialized, places, there's a way that you can go and do some government service and then go back if you ultimately want to.
Yeah, that's really cool. So I think of DARPA as like, that's obviously the military arm of the research, and they seemingly throw unlimited resources at projects to solve them, but it's very time limited and it can stop from a moment's notice. So it's almost a little bit like cocaine research. You can dispute that if you want. So what was that like? And what was a day to day, or how was that different maybe than being a professor researcher?
Yeah. As I mentioned, I felt that the DARPA model just resonated on a very personal level with me in terms of the style of the research. So I love quick, focused, high risk of research. And it's because if you go after those kinds of challenges, no matter whether you succeed or you fail, you learn from the experience and you fold that learning back into whatever you do next. I still approach science in that way. So again, there's a couple of ways that people like to think about science. Some people are the more methodical, kind of slow, methodical, really think about it before you get started. And once you get started, you're on a pathway and you incrementally grow. I like doing leaps. And you're doing leaps because you're trying really hard and risky things. And again, there might be a huge chance that it doesn't work out. But again, the caveat there is if it doesn't work out, you must learn from the error and you must do it better the next time. DARPA is all about that. And the tool that DARPA uses to really sort through whether you should go on these paths or not are the Heilmeyer questions. You've probably heard either from Jack or from Doug about the Heilmeyer questions. And anybody listening, if you've never seen the Heilmeyer questions, just go on your search engine, search for Heilmeyer questions, and apply them to new problems or challenges that you're trying to go after. And I guarantee you, if you spend a little bit of time answering those questions, it'll help you to clarify what you're exactly working on and help you to figure out what you're going to do next. Again, I still apply using the Heilmeyer questions to a lot of the stuff that I do today. And again, it's that speed and high risk, but learning plus the Heilmeyer plus resources, which really makes the impossible possible. And the other part that I just really resonated with me about working in the DoD is I love the structure of how DARPA works. And so you'll probably hear like a lot of different perspectives on it. Some people say the DoD is like too complex. If you worked in really large organizations, it can be tough. But at DARPA, the flat organization plus the desire to make good decisions and do that fast, it's remarkable. I love the rigor of that. I love the crispness of working with within a defense organization. And with the right empowerment and accountability and responsibility, you can do some extraordinary things.
Yeah, that does sound very fun, engaging. So yeah, I guess the Hail Mary questions, what are you trying to do without using jargon? How is it done? What are the limits of current progress? Who cares? What are the risks? How much will it cost? How long will it take? What are the midterm and final exams as a check for success? And I abbreviated that. So I think it's very good questions to ask. So what was your day-to-day like? And obviously those terms are only for 4 years. And so what was like the middle and end of that look like?
Yeah. So the best way to describe an experience at DARPA is that you're running around with your hair on fire. I feel like I probably didn't sleep for all of the years that I was there. And yeah, so I was at DARPA for a total of 6 years. Again, that's kind of unusual to go long terms over there. It's usually like 3 to 5 years that you have a term limit. But since I had a number of roles, it was a little bit longer. But to the speed and the pace, again, another way to characterize it, I probably felt like I did 20 years of work in those 6 years. And let me just give you some highlights of that. So again, when I started, remember, primary goal and mission was support the President's Brain Initiative. I launched like 3 gigantic programs in neurotechnology, each one with $70 or $80 million behind them, and found some of the best teams in the world to do that. So what did we accomplish in just like a couple of years? Most dexterous prosthetic arm used bidirectionally, movement and sensation in a person with spinal cord injury. We facilitated memory formation and recall in a human using a direct brain machine interface. We even did work of transferring memory from one individual to another individual using a direct brain interface. We, with teammates at Stanford, helped to pioneer the clarity process for brain tissue and optogenetics and all of those kinds of things as a part of those programs. I mean, those are just like a few of the neurotech things that we went. Oh, one more. Help a person living with severe anxiety use a direct brain interface to reduce their symptoms of anxiety and live a little bit better life. So closed loop neural interfaces for neuropsychiatric disorders. Okay, so again, in humans, full closed loop neurotech, again, hardware, software, clinical practice, all of those things in a couple of years. And if you talk to anybody in industry, even academia, most of them would be like, first off, you can't do all of those things. Second off, it would be like 50 years before you would ever see that in the light of day. And again, it really shows what you're able to achieve. Now, one other thing I just want to share with you, that was my role as program manager. When I became the office director, the kind of things that I did, the scope of them just expanded even more. While my base is in neurotech, I got to work on gene editing and synthetic biology and pioneer that whole field with a number of other program managers and researchers. We pioneered work in infectious disease. So, a lot of people don't know this, like the mRNA vaccine that's being used for COVID, that has its roots in the office that I used to direct in the work that we did in infectious disease. Again, if that never happened, you wouldn't have today probably the possibility of using messenger RNA for infectious disease like we are. So, I share with you those other examples outside of neurotech just to highlight like how special that office is, that I used to direct, and the speed, the pace, and the willingness to try really hard projects and actually make real progress that could impact the world. That hopefully you can get a feel for what was it like inside of that in a day-to-day kind of a thing.
Yeah, it sounds like you had big shoes to fill, and it was really, you had to live up to everything. And it sounds like you did. But all good things must come to an end. And afterwards, those terms are only for 4 years by design to get fresh blood in there, fresh ideas. You went to go work at Battelle. Do you want to talk about this a little bit?
Yeah, absolutely. And so one of the things that DARPA is really good at is showing what is possible, right? So again, I rattled all of those things off to you. Movement and sensation neurotech, memory neurotech, neurotech for neuropsychiatric illness, gene editing, synthetic biology, showing that it's even possible, even in new kinds of vaccines and things like that. That's awesome. It shows the world that a crazy idea can be brought to life. The part that DARPA really struggles with, though, is translating that neurotech or biotech in general into something that the world can actually use. Okay. that's not DARPA's role and mission. DARPA's role is to show the art of the possible. So when I got done with DARPA, again, when I got to the 6-year mark, and I still had another year on my contract, I could have stayed for a little longer if I wanted to. But I was at a point where I was like, look, we had done so much breakthrough stuff. It's great, but I want to take a step to try to get it out into the world. I came across Battelle, which is the world's largest not-for-profit research and development organization. And the company plays this very special role in the research and development of our country. It's halfway between academia and true commercial kind of companies. So it's this great place where I could still work on all of those areas, neurotech, gene editing and synthetic biology, and infectious disease, and have a platform in which to mature those technologies and get them out. So for example, I brought all of the experience and kind of know-how of neurotech to Battelle, and this was a place that was already doing neurotech. Again, you can see the work in restoring hand function through a direct brain interface in a wearable technology that the group had done even prior to me joining. But then when I did join, I said, okay, how are we going to take this to the next level? And today we're using that foundational neurotech and more to address spinal cord injury and stroke in the medical domain, but we're exploring using neurotechnology for other defense kinds of applications. I think of the very tough job that military personnel need to do as a part of their missions and how neurotech might enable them to multitask or deal with the kind of cognitive load of those things. And then we can even branch off into other areas like maybe neurotech can be used for sports performance. Okay. Again, all of us might want to use neurotech in our everyday life beyond medical. There might be other applications in neurotech that could open up there. And then in addition to things like that, there's also like gaming and entertainment. Neurotech could provide a whole new conduit for having immersive experiences and very rich kinds of like gaming types of environments. So again, I've joined a place that has an appetite and desire to continue to push neurotech as a main part of the business, and also a place that has the fortitude to do neurotech in those 4 domains. And I don't know of any other place in the United States or even beyond that's willing to think as broadly as that and go and take those challenges on to mature neurotech into those kinds of spaces.
Yeah, for sure. I'm a big fan of Battelle. We've had David Friedenberg on the show, and they're always involved in a lot of these spin-off, bench to bedside, like bridging the gap side of things. And I think it's really important, and it doesn't happen quite enough. I do know of Fraunhofer Institute in Germany that also fills this role, not so much in neurotech, but I think Battelle is a bigger focus on that. But yeah, when I saw that announcement that you joined Battelle, I'm just like, that was a good choice. I thought that was really good. So yeah, what does that look like over there? Your official role is Life Sciences Research Technical Fellow. I don't know what that means. What do you do, I guess, day to day?
Yeah, great question. In a nutshell, I help to develop strategy in biotechnology across all of the businesses that Battelle has. So Battelle has really 3 main businesses. So it's health, national security, and environment and infrastructure. But to put a little bit more granularity on that, and let's just talk around neurotech. Part of my responsibility is not only like framing what I just described to you is what is our growth strategy for neurotech in medical, defense, lifestyle, or sports and gaming. But then I get to work with the scientists that are actually at the bench doing the tech. So like Dave Friedenberg is a guy that I work with a lot, that we talk about algorithms and how those algorithms should be developed moving into the future and how we should apply them and exploring new challenges. And then all the way to like our clinical team that are working on new rehab protocols for our neurotech and using it with people that have movement disabilities. So again, it's this kind of wonderful kind of advisor role, but also like technically oriented, but with the goal of trying to commercialize neurotech, like do the fundamental science on the breakthrough and then commercialize it in the long run. And then the additional part of the fun part of the job is that as a part of this like translational nature of it, I get to talk with some of the biggest companies in the world that might license the technology that we've created IP around and figure out new paths for them to build that into their product cycles while we're still doing the innovation side of neurotech and beyond. It's very unique to have an organization that kind of fills that role, the advanced developer, the hard problem solver, the IP generator, in order to establish new commercial products that the world will know and love over time.
Yeah, that does sound really fascinating and exciting. And again, it extends from that, the role at DARPA. And I heard that the big benefit at DARPA is like being able to pick up the phone and knowing that they'll answer on the other side.
And I continue to do that. And that's another, just a message for your audience, is that connect with people not only in, but also beyond your field. Get to build your network of people, build a foundation of really solid scientific work so that they know that when you're calling, that it's going to be real and it's going to be a good conversation. Yeah, it's just so important for people, not only early in their career, but also late in their career to do those kinds of things. The other thing else is related to all of this, and it's related to the commercialization of neurotech. That's another part that I think a lot of people in the field haven't figured out yet. So let me just encapsulate that. What is the sustainable business model for neurotech? Go out and ask people that question. You'll probably get 100 different answers. And I think it's also safe to say that I don't know if there's really a solid example of somebody that has really established neurotech. And when I say neurotech, the high density electrodes for movement, control, sensation, like everything beyond traditional, let's say DBS. Because like DBS, I think is a special case that there is a sustainable business model there for movement disorders and related fields. The newer and the kind of the different neurotech that we're talking about, that sustainable business model, I think, is still in flight. And that's another thing that I get to work on and have a lot of ideas on how to do that correctly. And I'm also at a place at Battelle that is interested in that. And I think that we've got a team of people that has the talent and the experience to really to figure it out.
Yeah, definitely. That is something that everybody's been trying to figure out, just racking their brains. How do we get this to work? How do we get it to be self-sustaining? I don't think Battelle is as secretive maybe as DARPA, or like they can talk about some stuff. So what are some maybe specific projects, and obviously you can be as general as you want, that are exciting you nowadays?
Yeah. So a few ideas on that. And let's just talk about sustainability, okay? And again, this is no secret. I think a lot of people in the field know this. There are multiple timelines that are associated with bringing neurotech to market. The medical side of things are usually longer term, right? That you've got to go through a rigorous regulatory process, and there's like an uptake process, and then there's a reimbursement process, and there's all of those things that go around medical neurotech. And we're exquisitely focused on those things, and especially for stroke and spinal cord injury. So again, you've heard probably from your previous work and talk with Dave Friedenberg, we've got a brain interface, and we've also got wearable technology that can interface with nerves and muscles. The combination of those two components to enable somebody to connect with whatever they want to connect with is just a wonderful substrate in which to deliver new therapies. And just to give you a flavor of a few of those, if you're paralyzed and you want to reanimate your hand, we've got a technology that can do that, and it's maturing, it's going through the regulatory process and things like that. The other end of the spectrum, let's say you're living with stroke, and maybe you don't need the brain interface, but you still just need a muscle and nerve interface, and you want to get a new kind of closed loop rehab protocol that is, very different than the go into your rehab doctor now and they just tell you to do a couple of motions and maybe it works and maybe it doesn't. A closed loop interface in that domain will allow a physician to know exquisitely what's going on with your nerves and muscles, to tailor the kind of the protocol that you need to enhance those nerves and muscles. And then even through some closed loop feedback might enable you to train those nerves and muscles to get better function than you had today. Okay. So again, those are examples of stuff that we're working on, long runway for kind of getting those to humans and in clinical practice. Now, the flip side of that, though, is in that last example of a wearable neurotechnology that you can interface with your nerves and muscles, that's something that you and me could use even today. And there's a wide variety of like creative uses of that that we might be able to take to market, like a product to market that could be a very short term. For example, like a little over a year ago, I was at CES, the Consumer Electronics Showcase, and I showed an example of using that wearable technology on how to teach people how to play golf a little bit better. So write in the muscle activation, the nerve activation you need to improve your golf swing. So again, that's something that like maybe the vast majority of people working in neurotech might never think about. They're always focused on other more medical aspects. But we saw that as wow, you can get nerves and muscles to work in that way. And maybe I can transfer the muscle patterns from a pro and into a novice, or maybe even just like coach a novice a little bit better, or even understand their fatigue patterns a little bit and give them some coaching that way. That's something that we could take to a major sports equipment provider and say, look, we've got this neurotech. It might sound like a futuristic kind of technology, but it's a here and a now, and we can turn that into a product tomorrow. So again, it's that dynamic of near-term and long-term technology, finding ways of creating a sustainable, business opportunity around it that I think is going to really propel the whole field forward. So you ask, what do you focus on? Is trying to solve these kinds of problems right now and be really creative about how we do that moving forward.
Yeah, no, I think Battelle's the right place to do that. I think I'm excited that you're there and working on this kind of stuff. I guess as we're finishing up, I wanted to ask you, you wrote a book about all this. I'm very curious about it. Do you want to talk about this a little bit?
Yeah. So interesting story about the book, and it ties into a lot of what we were talking about. So back when I was at the University of Miami, I was trying to train the generations of the future that would be working in neurotech. And again, back in that time, whenever like somebody was building a course around neurotech, it was always these kind of like courses where they're doing like just literature reviews. So you look at the syllabus and read this paper, that paper, the other paper. Like there was no cohesive kind of didactic text that would pull all of the pieces together and at least give a new person the foundational knowledge that they would need to be effective in neurotech. I wrote this book on neuroprosthetics and neurotechnology, and I walk through all of the major components of neurotechnology that one would need to know, everything from the hardware to the software to the kind of the implementation, even like the design principles for that. And I had always envisioned using that book as a part of courses that I would be teaching for many years at the university that I was working at. Obviously, that didn't happen because I got a call from DARPA and my career path changed drastically. But I definitely recommend anybody that just wants to know some of the foundational work of neurotech all in one place. It's a good book for those kinds of things. It's got some good questions to think about in there too that kind of help you figure out what that information means and how it might apply. I think as time goes on, there'll have to be new neurotech books written, given all of the latest information. But again, at least when I wrote that version, that was the intent. And to this day, whenever I like meet somebody, let's say an investor or a business person that like might not know the field of neurotech, I also just recommend that. Like, hey, just go skim this book. It'll give you some of the foundational information that you'll need to know in order to make good decisions when it comes to neurotech. And just to foot stomp that one more time, we started at the early end of this call about understanding like what is hype versus what is not hype and things like that. This is also an effort on my part to help to get people to a foundational level of understanding of neurotech so that we can really build the field in a sustainable way moving forward.
Yeah, definitely. And I guess investors have a big part in that. So it is more of a textbook versus a cuddle up and under the blanket kind of book.
It's definitely more of a textbook. And so I've written a couple of books throughout my career. I always vow that I'm never writing a book again whenever I get done with it because it's so hard to write them. Yeah, I haven't written the kind of the cuddle up book on an experience. Maybe I'll write one day about some of these experiences over the last few years and how they've made an impact not only in my life, but maybe something for down the road.
Yeah, maybe. I think that could be interesting as well. So Dr. Sanchez, I think this has been great. A nice little history of what you've done. And usually we don't do this. We talk a little bit more about research and everything like this, but I think there's just so many more nuggets of like things that you experienced within this that it is very useful. As we're finishing up, is there anything that we didn't talk about that you wanted to mention?
Yeah, there's just one point that I'd like to really share with the audience, and it's always push the boundaries of what you're doing. Never assume that your life and your research or your career trajectory is going to be a static thing. There are twists and turns that are going to be coming along the way. Embrace them in every way that you can. And if you put your best work forward and you push those boundaries, there's no limit to what you might be able to achieve. Thanks so much for having me on your podcast. It's just been awesome reliving some of these things, and it's just been really fun to talk about all of it today.
Hope you enjoyed the show and were able to learn something new, bringing together different fields in novel ways. Until next time on the Neural Implant Podcast.